Hi, I welcome you all to Edentophasia again. Today we are going to discuss something which is very common and everyone suffers from it some or the other time in the life. We are talking about tooth sensitivity. Have you ever experienced while having that delicious ice cream, that favorite ice cream of yours from Naturals or Ben & Jerry's, that you have sudden something in your tooth and you just can't, you don't know what it is and it's just a little bit of shock which your teeth gets? Or when you have that hot sip of soup, tomato soup, or you have that hot cup of coffee or tea, and when you take that first sip you just feel like my tooth is just having a little bit of shock, and you know exactly which tooth and where it's happening. That is tooth sensitivity. Tooth sensitivity happens because of a lot of reasons. We are going to discuss today why tooth sensitivity happens, how can we prevent it, what are the home remedies we can do around it, and when is it the time that you need to go and get yourself checked in a clinic. So before I start explaining you about tooth sensitivity, I would like to tell you a little about the tooth, the anatomy, so that you understand why tooth sensitivity happens in the first place. So again, I have a little diagram. So this is the diagram of a incisor, the first tooth, this incisor. So it looks like this in a cross section, okay? So this you see is the enamel, the outermost layer. This inside, the one which has stripes, is dentine, and inside the black portion is pulp. So pulp is something which has all the nerves and blood vessels. So anytime you have any pain, sensitivity, or any feeling, any sensation in your teeth, it's because of pulp, because it carries all the nerves and it gives the signal to the brain that there's something wrong. Sensitivity happens when this portion, dentine, gets exposed. So there are only two places where the dentine can get exposed. So the top portion of the tooth, so this is the tooth which is inside the bone. So in the top portion it is covered with enamel. Do you see this white layer? So either this white layer gets abraded, that is when sensitivity will start happening, or the gum which is here, which is covering the tooth, the dentine, it gets abraded. So either there is a gum disease which is causing the root dentine to get exposed, or there is something happening in the enamel which is again exposing the dentine, and now this dentine is in direct relation to the pulp. So whenever something comes in contact with dentine, which is a little different in temperature than the normal temperature of the mouth, this dentinal tubules, they give signal to the pulp and you feel that sensitivity. Sensitivity can happen while eating sour or sweet food or hot or cold food. Let's discuss why tooth sensitivity happens in the first place. So then there are certain extrinsic factors. Extrinsic factors as in something which we are doing, which is not happening inside the body, and we are doing it. Those are extrinsic factors. Then there are certain things which are intrinsic factors, as in some bodily factors which are happening, and that is why sensitivity is happening. Extrinsic factors again can be divided into two. There is something which you are doing because of which you are doing it wrongly, that is why you are having sensitivity, or there is something or some clinical procedure you have had on your teeth because of which you are experiencing sensitivity. So let's see what you might be doing wrong because of which sensitivity is happening. The first and foremost, which I have been discussing in my previous videos also, is hard brushing. Whenever you use a hard toothbrush and you use a lot of force to brush your teeth, what happens is, while you are brushing, there is a probability that you remove the layer of enamel. So when you remove the layer of enamel from the teeth, the dentine gets exposed. When dentine gets exposed, it will give the signal to the pulp that there's something wrong, and the sensitivity will happen. So imagine that this is such a beautifully made system by God, that whenever something wrong has started happening, your body will give signal to you so that you stop it right then and there. The next reason why sensitivity can happen is if you don't floss in between your teeth. When you don't floss in between your teeth, there are a lot of chances that there are tartar and plaque which is getting accumulated there. What will that do? Either it will cause dental decay, which will again take out the enamel and expose the dentine, causing sensitivity, or that plaque or the tartar might go inside the gums which is there present in between the teeth and cause irritation there, and you will have a gum disease, because of which the gums will leave the side of the tooth. Other than that, there are other two things. If you have recently got a scaling or polishing done for yourself in the dental clinic, that is when the dentist might have prescribed you a week's mouth rinse and a certain gel to apply on your oral cavity, because that can also cause sensitivity, increased sensitivity, because we have cleaned the teeth from near the root surfaces. So there is a possibility that you might experience sensitivity for a week's time. Or else, if you have had tooth whitening done, which is very trendy these days, people just go for teeth whitening for no reason, no joy, but they want it. We will talk about sometime later about tooth whitening, whether it's good or bad, but let's stick to today. So teeth whitening, whenever you get your teeth whitening done, that is when also you might feel sensitivity for a week's time or 10 days in your teeth, because it works in the enamel, the whole thing, the bleaching solution, it works in the enamel, and you might experience a little sensitivity. But these two sensitivities are something which will subside over a period of time. Now, there are certain things which are systemic in nature, in which you don't have any control. Like if somebody has gastric reflux, some people have this acidity issue in which they have these gastric reflex in their mouth. So what happens is the acids from the stomach, they come and they usually regurgitate, and you have this vomitous kind of thing early in the morning. So early in the morning when this happens, your mouth already is dry, you don't have much saliva while you're sleeping, and when you wake up and you have this acid reflux, what does this acid does is usually etches the enamel from the behind of your teeth, from the side which faces the tongue. So it usually comes from the throat, and behind of the teeth, all the teeth, they have a little erosion of enamel on those areas, and teeth can become sensitive. So this is something in which you don't have control. You will have to get yourself checked from a gastroenterologist or do some remedy for it. If that gastric reflux reduces, then there are things which we can do to reverse this. Other than that, there are certain systemic diseases in which the enamel formation is a little defective. In that, dentine sensitivity can happen, over which you don't have any control. And then there is something called bruxism, in which patients or it's usually seen in small children when they have this habit of chewing their teeth and they make sounds with their teeth. So what they're doing is they're grinding their teeth at night. So bruxism can happen either habitually, or it can happen because of stress. So these are extrinsic things over which you don't have control, but they can indirectly cause dentinal sensitivity or tooth sensitivity in your teeth. So now that we are clear with all the causes of dentine sensitivity, let's look at what can we do. So there are certain things which you can do at home to treat your dentinal sensitivity or tooth sensitivity, and then if those things cannot control it, then you might have to go to a dentist. Again, I'll reiterate, whenever you have the first sign of dentinal sensitivity or tooth sensitivity, you catch it then and there, you start remedying it. You might not have the need to come to us later on. So let's see what all you can do at home. So again, I have said this many a times, use soft bristle toothbrush or medium bristle toothbrush with very gentle hands. You have to clean your teeth for 2 minutes twice a day, but it should not be harsh, it should not be with a lot of pressure. So whenever you feel that you have a little sensitivity, switch to a soft bristle toothbrush. Okay. Whenever you feel that you have a little tooth sensitivity going on, avoid drinking citrus juices or aerated drinks which have soda and all in it, because those are things which will make the pH of the mouth acidic. In acidic pH, the erosion will happen more quickly and you will have more dentinal sensitivity. So avoid having citrus things or acidic things, just for a period of time till the time you heal your sensitivity. Then there are very good desensitizing toothpastes which are available in market. You might have seen the ads of Sensodyne and all in TV, and there are many such things which are, I don't want to take brand names here, but I might leave a few links on my description box below if you want to check. So what do you do is so there are two things which you can do with this desensitizing toothpastes. The first thing is you can use like a regular toothpaste with your brush and brush softly all your teeth. And the other thing, if you have a little more sensitivities, you could take a little piece, half a pea sized amount of that toothpaste in your index finger and try and massage it on that area where you have sensitivity. Don't try and take it inside. Massage it for a minute or so, and then you might just rinse your mouth and throw it out. So what it does, it gives a little topical application in the concentrated actual area where you have sensitivity, and it will reduce the sensitivity a little faster. Then we have certain fluoride oral rinses which you can use. What fluoride does is it repairs enamel. So It's again a process which I don't want to get into detail of, but if this is enamel and this is a gap created, sometimes the fluoride goes and sits here and it makes a stronger element, which is fluorapatite. So fluoride mouth rinses are also very good when it's initial tooth sensitivity. Your tooth has not gone through a loss of enamel completely, it's just starting and you are starting using it, it can show very good results. Other than that, certain food like spinach, bananas have also been proven to reduce tooth sensitivity because they're high in calcium, magnesium, which is very good for your strength of enamel. They have vitamin C, which is very good for your gum health. If your gums are healthy and they're holding the tooth tight, the dentine in the root doesn't get exposed, so sensitivity reduces. And again, they also have oxalic acid, which again are numbing agents which numb the dentine, and then the sensitivity reduces. So these are the things which you can do at home. So now let's come into things which dentists can do in their clinic. So if you have brushed your teeth a lot and there are dents inside your teeth, sometimes patients come and they have brushed so much that there are dents like this on their teeth. So what we do, a tooth filling is done in that area so that this area gets covered and you are safe from your sensitivity. That is one thing which can be done. If it's something which, if the filling is going off regularly, we might put a cap over it so that the cap stays there and covers the dentine and you are okay with the sensitivity. Last treatment is, if nothing else works, what we have to do is we have to do a root canal treatment, which is called the intentional root canal treatment. Why is it intentional? Because your tooth did not have a cavity. It had sensitivity which was not getting ruled. So we had to intentionally take out the pulp from it so that the sensitivity of that tooth goes away, and then you put a cap over it. So that is the last most treatment we do. If all those things which we could have tried at home or at the first place, we could have been careful and not have sensitivity at the first place, or if we had sensitivity, we could have done some home remedies and worked around it. If all those things fail, the last thing is root canal treatment, which is again a costly affair. So again, I want to reiterate, dentistry is not costly. Yes, our neglect or when we do not pay attention to what our body is trying to tell us, then it really gets costly. So again, to put a point, a little bit of sensitivity when you try to bite ice and when you have ice cream, that's fine, but it should not be something for which your hand goes and you really feel that there's an urge, that there's something really pinpointing somewhere. A little bit of sensitivity is fine. That is again a natural way of our body to tell us that this is a very cold thing, be aware. This is a very hot thing, be aware. So I hope you found this video helpful, and I hope that I could demystify tooth sensitivity a little bit for you. And if you have any such problem, or any of your family members or your friends have that problem, you could just share this video or share this knowledge with them. And if there's any issue, you could write to us. I'll link my email address and website in the description box below. And there are some very good videos which I've made, and I'm going to link the last video somewhere on the description box and on the info above the video, and you could just check it out. It's about dental cavities, how they form and what can you do to avoid them in the first place. So eDentofacia again is a channel where I want to talk only about preventive dentistry. There's a lot of restorative dentistry, as in corrections happening about teeth, their color, their shape, everything happening all throughout the world. I want to work around where we can try and not go to a phase where we might need treatments around it. I want you all to become so aware of your oral cavity, just like our bodies and our houses and our money and everything, that we take care of them so nicely that we might not need corrections around them. So if you like this video, please give it a thumbs up and a like, and comment down how did you like it, and share with your friends and family. And please press the bell icon so that you know whenever I upload the video next time. Every week I'm trying to upload one video on Wednesdays, and help me build up a community of oral health conscious people and make this world a cavity free world. Take care, stay safe. COVID has not yet gone. Be inside your homes. Take care of your teeth, take care of your health, and lots of love. Thank you.